I'm Hannah Smith. I work for Mercy Community Healthcare. Some of you who are native to this area know Mercy Children's Clinic. We've been in the community about 14 years now. Back last June, we now opened an adult space so we can take care of our children as well as their parents now. So that's been very exciting. I grew up just down the road in Columbia, Tennessee, so kind of familiar with this area, and went to school at Lipscomb University in Nashville. Graduated with a dietetics degree from there. Had sort of, to borrow the Lemony Snicket term, a series of unfortunate events after graduation. So not a dietitian, but I went into insurance billing and worked in that for several years. And recently heard about the opening at Mercy for an outreach and enrollment counselor. So I'm doing a lot of public education about healthcare reform. I'm also a certified application counselor, so I have been through the federal training. I've enrolled quite a few people. I haven't totaled them lately. Sometimes I've totaled them just to feel better about myself, but I've been so busy lately, haven't totaled them up. But very, very, very familiar with healthcare.gov and everything going on there. Yeah, so background in billing, do a lot of explaining. This is how health insurance works. This is what, let's run this scenario. You typically go to the doctor 4 times a year. Okay, how's that going to pan out with this plan or that plan? Do a lot of sort of counseling people on what would be a good option for them. Part of being a certified application counselor is that I'm completely neutral about the different plans that are available. I'm not in any way associated with any of the plans, but I do, try to help people understand what their healthcare needs are going to be. Let me talk a little bit more about Mercy. As a clinic, we are a federally qualified health center, so that just means we see people regardless of the ability to pay. We see a lot of uninsured people, a lot of people with TennCare, and of course we accept private insurance as well. Because of that, we got, of course, the grant from HRSA, from the Health Resources and Services Administration. So I'm hired from that. We got certified as this, certified application counselor organization. So we have 6 people on staff who are trying to do what I do. I'm the only one who does it full time. All the others were existing employees. So yeah, we're enrolling a lot of people over there. One sort of, I guess, silver lining. I mean, there's really no silver lining to our government not expanding the TennCare program, but it is nice to be able to then tell people, even those who are falling through the cracks, you're still welcome to come to our clinic. We do see people regardless of their ability to pay. So, of course, we are primary care, so we of course have people who need specialists and things like that we may not be able to address, but someone who's uninsured may not want to pay $75 to go to the walk-in clinic, but they may be able to pay $15 to come see us. So it's very rewarding, I guess, working there and still being able to give people, an affordable healthcare option. So, anyway, pass it on.
Hannah, excuse me. Sure. Is there a clinic anything like yours in Davidson County?
There are federally qualified health centers in Davidson County. You can, actually, I'm sure that Sandy will be able to tell you more about that because they refer a lot of people to different FQHCs. I have pulled up a map. I mean, if you went to Google and you typed in FQHC map Tennessee, you would be able to pull up these other federally qualified health centers. And to be a federally qualified health center and receive that government funding, you do have to see people regardless of ability to pay. So you can find it that way. Sure.
One more question.
Yeah.
To sit down with you, does the person have to make an appointment? Or
Yes, just because, especially in this at first no, but especially in this last month, right now I've booked a week out on my appointments to enroll people. So yes, ma'am. But I have cards. If you want to get some cards, then you can come in or send somebody else in.
Good afternoon. I'm John Green. I'm an attorney here in Middle Tennessee. It's a little ironic that I'm on a panel discussing women's health issues. Grateful to the OFA and honored to be here among these distinguished panelists. I'm here, I think, as a guinea pig, not because of any particular legal expertise on the act itself. My personal story is not unlike Zola's. Contrary to what Linda said, I am going to ask her for a piece of her shirt that I can. Although I started my legal career 25 plus years ago in a firm, I didn't stay in that firm very long, and for over 20 years I was a sole practitioner, which means a small business owner, effectively. no entity or organization responsible for providing insurance for me. So I had to purchase my own insurance. And over a couple of decades, insurance for myself and a daughter as she aged. She's now 21 plus and still able to be covered under my policy. But over those years and decades, I saw my insurance premiums increase dramatically, sometimes exponentially, it seemed, while the quality and breadth of coverage diminished correspondingly. Frustrating. In June of 2009, without real explanation, my insurance was terminated. Now, I have a couple of health issues that aren't particularly unique, nor significant, nor unusual in the world, but trying to shop for insurance, I was repeatedly denied coverage because of these, quote, issues, end quote, and I was termed uninsurable. Well, once that happens to you, that it is perpetuated, and it became increasingly difficult. So I ran absolutely uninsured, which is not a great place to be. Now, mind you, I'm relatively well educated, and I'm certainly in a position where I could afford insurance. I even offered the insurance companies to, pay a bonus on a premium, which is absurd. But I continued to be denied coverage. The ACA came along. Like Zola, although her once-in-a-lifetime chance was meeting the president, mine was getting insurance. I think we know who got the better end of that deal. So I enrolled relatively quickly. I understand that there were difficulties that many people experienced, it was all over the news, in trying to access and work the website. I guess I was lucky. I got on pretty quickly. I registered fairly quickly, relatively simply. I'm not particularly computer literate, but I didn't have a problem doing it. And I was relieved, I was thrilled, I honestly was excited. I did not buy insurance right away, and here's the reason. And I don't mean to call Jarvis out on this because I'm sure he's not responsible for it, but the complexity, almost indecipherability of what the insurance companies had drafted and posted from which I was supposed to select. Now, mind you, I'm educated and I do a lot of insurance work. I can only imagine what a stonewall it is for people who don't have that kind of experience. That's why I waited weeks. In fact, I got apprehensive about buying insurance, ashamed and embarrassed that I couldn't figure it out. Well, I relatively recently went back and selected. It's reasonable, it was affordable, and I'm really, really just thrilled to have it. And I guess I'll pass it on. Thanks. Honored to be here.